interacting with the other regional referral hospitals, certain things not be appreciated. And this is the reason why we changed and say let's have a visit so that we understand what first hand pick what's on the ground, and then we shall definitely interface with you in detail. So our clerk will be communicating to you when travel to Kampala, and then we can handle some of the audit queries. I know we have asked you some of them, so we expect you to come along with those other documents as per our meeting this evening. So thank you very much for your time.
Honorary, you've been in Mbale Regional Hospital since yesterday. What has been your findings so far?
The hospital is overwhelmed by the number of patients. It's extremely unfortunate that the hospital, which is supposed to be really providing specialized services, is providing basic services that should be actually provided at the lower health facilities. We have seen cases of referrals of children who are anemic, and of course if these blood transfusions need, children that need blood transfusion, that should actually be provided even at general hospitals. However, what we have established is that the general hospitals, due to lack of blood, refer the children here, and therefore the children's ward is extremely overcrowded. And it's extremely unfortunate that they lack space but have nothing to do, and therefore you find 5 babies, 5 children sleep in one single bed. Of course, there are other audit issues that we shall be able to follow up with the hospital, audit queries, and we are impressed with the construction work that is going on. But it's unfortunate that it will take them another 3 years to finalize this building if the Ministry of Finance cannot front-load funds so that the contractor can finish. If front-loading could be done, then this facility under construction would be completed maybe in 1 year or 1.5 years, and that would help them to free, to have space for the children and other wards that are actually crowded. So the hospital is also underfunded for the drugs that they actually need. Their budget estimate for drugs is about 3.6 billion. Unfortunately, they receive just about half of that. And therefore, patients that come here buy drugs using their own funding. So the health sector, unless we get into the National Health Insurance Scheme, people will continue meeting health expenses from their pockets, which is really also not good, because at the end of the day, there is also exploitation by some of the unscrupulous health workers. Mbale tusanze mu Mbale Regional Referral Hospital mbi nnyo mbi ddala, kubanga ward eringa katale, abaana nga 5 bali ku kitanda kimu, ate kibi nnyo okulaba nti abaana bava ne mu malwaliro aga wansi agandi badde gabakolako, naye bajja mu ddwaliro eno Mbale Regional Referral Hospital kubanga tebalina musaayi. So singa blood transfusion service esindika musaayi mu malwaliro aga wansi nga general hospitals ne health center force, eno ddwaliro eno yandibadde terina abaana bangi nnyo ngaabo. Ate ne bbula ly'eddagala, kubanga government sente zebawa okugula eddagala temala, beetaaga kumpi buwumbi 3 mu miliyoni 6, naye nga babawa half, just miliyoni 1 biliyoni 1 mu miliyoni 8. So eyo temala, kitegeeza nti myezi 6 mu buli mwaka teri ddagala mu ddwaliro lino. Abasawo bakola mulimu gwabwe, naye nga abalwadde balina okugula eddagala. So twagala kusaba ministry y'ebyobulamu, ekizimbe kigenda mu maaso wano kirabye, singa basobola ekizimbe kikino kigenda okuzimba, kigenda mu maaso, naye kijja kumala myaka 3 mu maaso kubanga sente teziriwo. Singa government esobola, ministry y'ebyobulamu ne finance nebawa sente zino mu maaso, front loading, contractor yandibadde amala kizimbe kino mu mwaka gumu. Ekyo kyangiyambye nnyo kinene nnyo okukendeeza ku abaana 5 abasula kitanda kimu. Bandibadde ekizimbe kino ekirala bakifuula woodi y'abaana. So embeera mu Mbale Regional Referral Hospital si nnungi, era tuzze nga akakiiko aka Public Accounts Committee nga tulondola bivudde mu Auditor General's report, naye nga bye tulabye si birungi. Ne bajja mu Mbale Regional Referral Hospital ate bandibadde tebajja wano kubanga mu malwaliro aga wansi basobola okuwa abaana okujjanjaba abaana abasinga abajja wano tebalina musaayi. Amalwaliro aga wansi blood transfusion tebawa musaayi, so bonna babasindika mu Mbale Regional Referral Hospital. Ekyo kireetera Mbale Regional Referral Hospital kubeera n'abaana bangi. Abaana 5 basula ku kitanda kimu, abamu basuka nawo, n'abazadde ne babeerawo. So eddwaliro eringa katale, woodi y'abaana eringa katale.
What I would say is that what is happening is not the ideal. The ideal is that every patient should be on his or her own bed. But given the situation as it is, it's unavoidable that children have to share these beds because the numbers far outweigh the facilities that are available for them. That is, in terms of space, the beds would not be a problem, but we don't even have space where to put them. The beds are available. We have beds, but we don't have the space where to put them. So the beds that we can fix into the ward are those that can go in and can be used by the patients that are admitted. But still, the patients admitted are more than the beds that we have. Okay. Children sharing beds, which is not good. As I said, we receive drugs in a cyclic manner. Every cycle takes 2 months, but you find the supply of drugs that we get may last us 1 month and the drugs are finished. So you find part of that cycle, a number of drugs and sundries are already out of stock. So the drugs we get are not enough for the population that we serve.
That cannot be handled by lower hospitals. But we have discovered the influx of the patients who are being handled by the lower units at the hospital, and therefore it is a crowd. And we are seeing some of these causes. I think we did deal with preventive than whatever than cure. One, the undernourishment of children who are feeding and a bad environmental surrounding of hospitals. So for example, bushes, bushes and stagnant water, they cause mosquitoes. And even the lack of utilization of the mosquito nets that governments are applying. So we have a belief that if the homestead primary health care is handled, that some of these things will be avoided. Good feeding does not mean that you have to eat sophisticated food. For example, greens. Greens are a very good source of proteins and vitamins. Even our own matoke, even Irish potato. But basically it's to have the culture of feeding children on basics foods, which can be managed by any home. So we think that because they are malnourished, they are badly fed, they end up being vulnerable to sickness, and eventually they end up in hospitals, something which can be avoided. So I was encouraging the parents that let them look into those basics, feeding them well, drinking clean water. Clean water means you can even cook it with the water. So those are the issues. And at the same time, we are saying that the hospitals, the primary health care people, like community officers, visiting nurses, should educate our families how to look about their children, even themselves. And then we observe that we have a culture of bringing one patient comes with over 5 attendants, and that contributes to the crowd. But of course, as the colleague said, there's also financial constraint to the referral hospital. The structures are few, they're not well facilitated, and manpower is small. So we hope that when they come to Kampala Parliament, we shall discuss all those issues.
Tetumanyi ekintu kyonna kikola kivaako netukola netugwa abaana ne bagwamu omusaayi.
Nofuna ku butimba.